The goals for use of the stress ball or exercise ball during lymphedema therapy or following your diagnosis of lymphedema include, number one, preventing swelling and the decrease of swelling in your arm, chest, or breast region. You do want to be sure to wear your compression garment if you have those during your exercise, as this will create a muscle pump action in the muscles of your arm, hand, and chest region in order to maximize your decrease in swelling in that region. It will also help in maintaining and increasing your strength. It will help with maintaining and increasing range of motion if you have any limitations in your joints in your arm. And you do want to be sure to elevate your arm to at least shoulder height during the exercises, as this will maximize the reduction in swelling. And even better, you can wear your compression garment, you can elevate your arm and perform the exercises all at once. This will decrease your swelling and increase your outcome for your treatment for lymphedema. This also can help improve circulation and prevent blood clots in your arm and chest. If you're undergoing treatment for lymphedema therapy or have been through lymphedema therapy, whenever you're exercising, you want to be sure to wear your compression garments. Whether you have a sleeve, a glove, or gauntlet, you want to have those on when exercising whenever possible. The best tips for getting a compression garment on your arm and hand include folding it in half. Some of the brands do have a place for your elbow. Others are just a tubular garment. So be sure you look to see if there's an elbow place for that and then which direction to put your hand in. You want to fold it down about halfway, but knowing that you can see where the elbow goes. And then you want to put your arm in so that it's up beyond the wrist bone. And then fold up the top half in order to get it all the way up to your shoulder. You then may need to smooth the fabric to be sure the compression is evenly distributed along the garment. A donning glove can be helpful for this, which can be a garden glove or a dishwashing glove. Great. Notice how she's gotten that right above the wrist bone, and then folding up the top half. Being careful with the nails so as not to damage the fabric. There is a learning curve on getting all of the wrinkles out from underneath the upper arm. You can use a mirror to be helpful with this. And then the gauntlet or glove will go onto the hand and it will overlap at the bottom. Perfect. And just be careful that those two don't create a tourniquet effect there, to be sure to smooth out that wrinkle before getting that glove pulled up on the top of the sleeve. Great. For use of your stress ball during lymphedema therapy, number one, you want to be sure to have your compression garments on, your sleeve, and if you have a glove or gauntlet. Also, elevating your arm to at least shoulder height is important, as this will maximize the decrease in swelling in your arm and hand. Using the ball for exercise can be as simple as just squeezing the ball. And sets of 10 are always a good rule of thumb. Great. Another squeezing exercise, you may need to hold with your non-involved arm and using a pincher grip to pinch between each finger, going from your thumb, starting with your forefinger, second finger, third finger, and fourth finger. Again, be cautious if you do have limitations in any of your joints or hands, such as pre-existing arthritis or trigger finger, or have had any sort of carpal tunnel surgery or other surgery on your joints. We don't want to do anything to stress the joints. If you have any pain that wasn't pre-existing, then I would avoid that exercise. Other exercises are passing the ball back and forth between the hands. This will give some forearm exercise as well as some rotation at each of the shoulders. Great. Those of you that have had a bilateral mastectomy, this can help improve strength and range of motion on both arms. Great. The next one is just holding and having a squeeze and doing your wrist up and down, flexion, extension, and that's gonna work your wrist. And you can do like Janet and going up and down or turning your forearm sideways. Any exercise, be creative. These are only some guidelines. Another is keeping a firm squeeze and bending and straightening your elbow. This is gonna work your bicep and tricep. And again, creating all of that muscle pump action along your hand, forearm, and finger muscles.
Do I squeeze it the whole time?
You can, or you can pump, which is what I like to do when I'm going for a walk, is do that pump as you're squeezing. You can't go wrong here. You can squeeze on the way down, squeeze on the way up, whatever feels comfortable to you. Great. Now, you can also take the ball when you're walking. That's great to do your exercise. You can combine your compression, the walking for aerobic exercise, as well as arm and hand exercises with the ball. If you're traveling, is another good time to take your therapy ball with you, so that if you're in the car or on an airplane or just waiting for your destination, you can keep that arm propped on the windowsill or an arm on a armrest, so that you're getting that elevation along with the exercise. If you're undergoing any sort of infusions, you can take the ball with you to be used on the non-involved side, unless you have a port, in which case you should be able to use it in either hand, as long as it's okay with your nurse provider or your healthcare provider who's administering the infusion.